Good morning, everybody. Let's see, it's Monday, August 10th, and last week the Metro Health and the city and county had a town hall talking about um, what about schools, and there was some Q&A, there was a panel discussion, but the what I got out of it that I thought was the most important was this guy, and there's a link to it in the description. So this is the Bexar County Health Authority amended health directive dated August 7th, 2020. And like I said, there's a link in the description. And so I'm going to kind of summarize this for you all and offer kind of my commentary on it. Now, with the understanding that I am, I'm the leader of a nonprofit, I'm not a public health expert, but I hope that, maybe the comments on this post and in the discussion group, we can kind of talk through as a practical matter what this means. And I feel like I've been waiting all summer to get more information about, some guidance about what's safe for schools to be reopening. So a little bit of context. In July, the city and county issued an order saying that schools had to stay closed until after Labor Day. And then there's some controversy about, like, do local health authorities have the power to do that? Can they delay the reopening of schools, or do they only have the power to close schools if there are actual cases on campus? So right now, that's kind of in a gray area, right? The governor and the attorney general are saying one thing, local authorities are saying, this is our guidance. As a practical matter, it appears that most public schools based in Bexar County, whether it's traditional public school districts or charter schools, are choosing to follow the guidance from Metro Health and Bexar County. Now, if you live outside Bexar County, right, so if you're in Comal County or Kendall, then this may not apply to you. You'll need to look at your local health authority and see, like, what are the transition rates in your part of the area. If you live in Bexar County, but your kids go to a school that's part of Comal ISD or Bernie ISD, then your school will be opening earlier, because those districts are headquartered in other counties, and they're choosing to not follow what Bexar County says. So that's just a little bit of context. Okay, but to me, this directive is really, really helpful because it adds some detail, and it should create some consistency maybe across what different districts are doing. So now I also link to it's on the website. It's actually in color, but this is the on the City of San Antonio's kind of COVID-19 resources. They have a section about schools, and then under that they have reopening safely. So it's under, anyway, the URL's in the description. So it's basically, they keep it updated, and it shows, like, what's the school risk level, right? And they have low, moderate, or high, right, which is green, yellow, or red. Right now it's in high, which, if this were in color, if you're seeing it on the website, it would be bright red. So that's the current status. So if you're watching this video not on August 10th, but later, and you're wondering what is the current status of the school risk level, you can click on that link in the description. It'll show you the current status. So, but on the day that I'm giving this talk, it's August 10th, and the current risk level is high. So, okay, so what does the amended health directive say? So it's actually only 3 pages, but it's really dense with information, and I'm impressed with this document. I'm thankful for it because I feel like it gives there's no guarantees right now, and with what's happening, the science is still changing, but this at least gives what feels like sensible recommendations about what schools should be doing. Okay, so the first section is recommendations based on health indicators, right? So this is 3 different sets of guidelines depending on if we're in red, yellow, or green. So for the red zone, which is where we are now, it says in-person instruction is not recommended. Now, there's an exception for special needs students, at-risk students, and students who lack access to resources. So the suggestion is, okay, but the guidance is, try to help these students, but don't have prolonged close contact. And by that, they mean being within 6 feet of each other for 15 minutes or more, right? With the idea being that the virus spreads through the air, right? Through droplets that we breathe in and out. Okay, so they say no school-sponsored events. So no fairs, exhibitions, academic competitions, athletic competitions. There's an exception for drive-through events, so you can still have drive-through events. And then they link to the CDC guidance about athletes. So what they recommend is do strength building and conditioning at home, right? So that's what they recommend for athletes. Okay, in the red zone, use a fresh mask every day. Staff should wear eye protection if they're within 6 feet of students who are not wearing masks. And then there's a caveat that if the city county issue another stay home work safe order, right, which is what we had in the spring, then that means they want everything shut down, right? No exception for the special needs students or the at-risk students. So that's where we are in the red zone. You know what? I didn't. So yeah, and if you're wondering what status are we are now, you can check. There are factors. I didn't look this up before. There are factors for determining what is the risk level, right? So it's like how many cases, right? Like, you know, like right every evening they announce like how many new cases were diagnosed of COVID. You know, is that number dropping? Right now, the number, it's not as bad as it was in July, but it's still kind of seesawing, right? So it might be 200 one night, it might be 150 another night. So it's definitely better than it was in July, but the number is bouncing up and down. It's not a steady decline. Another factor they look at is like of all the COVID tests that are being issued, how many are coming back positive? And that number is dropping, but it's still really high, right? So it's maybe what 15%, 14%, but it's dropping. But maybe that number needs to get down closer to 5% before it's a good idea to open schools again. So there's other factors, you know, that they're looking at to determine this overall risk level for schools, right? Whether we're in the red, yellow, or green. So right now we're definitely in the red zone. Okay, so the health directive talks about risk levels in the yellow zone. What should schools do? So they recommend in-person instruction for at-risk students and special needs students and students who lack access to resources, right? Which I guess means like those students who don't have devices, don't have internet access at home, don't have like a workspace. So there's a link to CDC guidance for it, which is okay. So they say look at the CDC guidance for what to do when there is substantial controlled community transmission, right? So CDC has different guidelines depending on, you know, what's happening in your city. Okay, so one of the Bexar County recommendations is having fixed cohorts of 6 or fewer students per classroom. So that way, right, it's only 6 students in the group, and that group stays together, so that it's not as likely that transmission would go. It would jump from that group to a different group, right? So if one student in that group gets sick, it would only spread within that group, right? Okay, so they talk about building occupancy and room occupancy. It depends on ventilation. It depends on being able to create distance between those students. And they say neither building nor room occupancy should exceed 25%. You know, so that's giving schools some guidance about like how many students can you put in that cohort? Can you spread them out within that classroom? You know, can you make sure the room is not over 25% capacity? Make sure the building is not over 25% capacity. Okay, again, just like within the red zone, no school events except drive-throughs. For athletics, they suggest having small fixed cohorts of 6 students, right? So it's those 6 students who practice together and stay together, not mixing groups. There's a link to CDC guidance about youth sports. And again, just like within the red zone, they recommend that staff and students change their masks every day, and that staff should wear eye protection when they're within 6 feet of students who are not wearing masks. Okay, so that was red zone, yellow zone, and now they also have guidance about the green zone. So green zone is when there's minimal to moderate community transmission. And again, they have a link to the CDC guidance for that. So what they recommend is, all right, so green zone doesn't mean that COVID is eradicated from your community. It just means that transmission is still happening, but it's minimal to moderate. And yeah, so that might be misleading. You know, green zone doesn't mean it's all safe. It just means that it's not out of control. So they recommend social distancing by older children and adults, frequent hand hygiene, face coverings during high contact activities. They link to more guidance. And so more CDC information. Okay, they point out the indicator bar, CDC guidance for different levels of transmission, and then CDC guidance for youth sports. Okay, so those are the from the Bexar County Directive for red, yellow, and green. They have another set of guidance that applies to like all schools, regardless of whether you're in red, yellow, or green. And one thing they notice is that, or they note is, kind of the more of these good practices you do, the safer it is to reopen schools when you're in yellow or green. And you might even be able to have, larger cohorts if you practice these other, these other good practices that make people safer. Okay, so they recommend using, right, so these are things that apply in red, yellow, or green. These are recommendations. Using outdoor spaces, right? So we have kids learning outdoors. Let's see. Okay, they link to from a professional society, guidance for school ventilation, right? So how to make the air quality better in the schools. They recommend social distancing, including in staff break areas. Good point, right? Again, like making sure everybody gets a fresh mask every day. Okay, making sure that people who are from different households are not sharing food or sharing utensils. And hand hygiene, right? So hand sanitizer, soap, water, sinks, having good access to those. And then transportation, making sure that families can get their kids to and from school with minimal risk. So those are from outdoor spaces, hand hygiene, social distancing, ventilation. Those are things that are good practices that apply whether you're in red, yellow, or green zone. So again, we're talking, if you're just jumping in, we're talking about the Bexar County Health Authority amended directive. This was issued on August 7th. There was a town hall to talk about it, but the real meat of what's going on is in this document, and there's a link to it in the description of the video. So, okay, one thing that they mentioned in the town hall, and but there's details about it here in the directive, is these 7-person COVID-19 panels. I think this is really interesting, and I hope we have a good, lively discussion about this in the Charter Moms group. In fact, let me link to that. Here's the URL for our Facebook group. So I hope some of our members become the parent representatives on these groups. So, okay, so the idea is having a, it says every district or school system should create a 7-person COVID-19 panel. And the name 7-person panel seems to be catching on for these. And okay, so who should be the 7 on the panel? Okay, 1 student, 1 teacher, 1 parent, 1 non-instructional staffer. So that means, like they say, maintenance, custodial, food service. 1 school nurse, 1 pediatrician or adolescent healthcare provider, and 1 human resources representative. Okay, so that's 7. Okay, so I think especially important to me is the fact that they want a parent and a student on the 7-person panel. So charter moms and dads and granddads, okay, this is your call to action, right? Get yourself on one of these panels, right? Because we need to make sure that parent voice gets represented on these, right? Okay, so the purpose is that this panel will provide guidance to superintendents, principals, school boards. The idea is you don't want just the administrators making decisions. We want to make sure that students, parents, right, the custodians, the lunch ladies, right, they need to have a voice in this too. And having actual healthcare providers have a voice as well. I think that's really important. So I think it's a great idea to have these panels, and I encourage members of the Charter Moms group to like get yourself on these panels or find out what your school or your district is doing with these. Okay, so it says the school nurse or pediatric adolescent healthcare provider should serve as the liaison to Metro Health, including for notification of positive cases. So that's part of what the directive sets out, is this reporting requirement. Okay, so the directive instructs at district or school system level the creation of these panels. It says that schools may also have their 7-person panels. So that's interesting. Okay, so on the panel, the person who's the medical expert, right? If they're a pediatrician or school nurse, that's the person who should be doing the reporting to Metro Health. They're supposed to report weekly, number of cases among staff and students, how many staff or students got sent home due to COVID symptoms, um, how many people have flu-like symptoms, um, when they're sent home, things like that. So they now also districts and schools, it says, it's interesting. It says district and private school administrative offices, including charter schools, shall post weekly on their websites. So schools and districts are supposed to be reporting how many COVID cases, among staff, among students, how many staff were absent, how many students were absent. So basically, staff and students, they're supposed to report the numbers. They're supposed to report how many people were COVID positive and also how many people were absent because of symptoms, right? Because as we know, testing is still backed up. So yeah, this is going to be really interesting to know. I'm really glad that Metro Health is recommending this reporting because it will give us some insight about what's going on campuses. Okay, so by August 21st, every school system, right, district, charter, they're supposed to have a written plan of the health and safety protocols, and they're supposed to share it with the public, right? Put it on their website. So yeah, we have a page on the site that has school calendars and links to COVID resources. So we will be updating that with these safety protocol plans as well. So it's interesting to be able to compare across districts what they're doing, and like maybe the one for your own school, but you could look at what other schools are doing, and maybe you could suggest to your panel or your administrator, like, what you think your school should be doing to open safely. Yeah, okay, well, there's been some great comments during the, I was kind of on a roll, guys, but now I'm gonna get to the comments. So, okay, April, oh, thank you, April. Yeah, this document, I mean, the town hall, I appreciate that, but like, I really wanted to like get down to the details of this document. So that's why I think this is really important. Okay, Sandy says that doesn't even make sense. Unfortunately, Sandy, I didn't see when you posted your comment, but if you want to comment again and say which part didn't make sense, I can address that. Let's see, Tisha, thank you for important message. Those with autism, yeah, okay, at IDEA and Northeast ISD, yeah, doing virtual school. Yeah, Tisha, this is a lot like our situation. So I have two kids. My son is on the autism spectrum, and for us, the grandparents are part of our pod. So we have to be as careful as if we were 85 years old, like my dad. So we're doing virtual school for the foreseeable future. We've already signed up to do virtual school for the first quarter, and my kids go to back to school on Wednesday. Yikes, that's in 2 days. So yeah, that'll be interesting. But yeah, we're choosing virtual school. But I still feel like even though we've made the decision to do virtual school for the duration, until something changes, right? Whether there's a treatment or a vaccine or something. I want our community as a whole to be safe. And so, I worry about schools opening too quickly, and would that accelerate community spread? It's important for schools when they open, which they do need to open soon, because there are students and families who really need the on-campus support, right? Whether it's because of childcare issues, for working parents, students with special needs who need the one-on-one interaction with teachers. We should open schools as soon as we can do so safely. We can't just write off the whole school year. That's not okay. But so yeah, even though our family is choosing virtual learning, I want our community to be safe, and I want schools to open safely soon, so that the students who do need to be on campus, can get what they need. Let's see what. Oh, Crystal, hey, thanks. Just thanks for breaking it down. Yeah, these things, it sort of feels like it's like, oh yeah, I should read that. It's like, well, y'all, I will help you read it. Okay, we can maybe you're folding laundry or washing dishes or something. We can like listen to this like you're listening to a podcast, and I will break it down for you. And sometimes knowing helps us feel safer, right? If we feel like we know we have more control, and we feel like we know what's going on. And I'm really encouraged about these 7-member panels, because it's an important way to include parent voice and student voice and staff who sometimes get overlooked. Um, Becca says, agreed. Thank you, Becca. And thank you. Yeah, Becca, one thing Becca does that's great is she shares these in the discussion group so that the members of the group can see what I'm doing, because like I'm busy like typing. Oh yes, April says yes. Here's the link. Yeah, in the comment. Yep. Yeah. So yeah, that's what I mean, I'll be watching this. Um, I think it's great that Metro Health is giving schools more guidance about what to do. I mean, it's tough that it's coming so late in the process, but I think we're all having to learn to adapt and work on shorter notice than we would like. But if we're all careful and listening to science, and then yeah, then we can get through this together. And I just want to reinforce, like, what Becca and Ashley have been reinforcing in the Turnaround group, is that we need to treat each other with kindness. That everybody has their own struggles, and whether a family chooses to enroll their students on campus learning or virtual learning, whether they set up a pod or if they try to go it alone, your family the best. Like, you're the one who knows the factors involved. I just encourage everybody to think about the well-being of our community as a whole, right? So, whatever you can do to slow the spread, that helps keep everyone safer. And, whatever we can do to make sure that the families who, don't have access to devices or internet, the students who need to be on campus, because whether they have special needs or, they just need that support from their teachers, that um, we always need to keep in mind the less fortunate among us, and make sure that their needs are met. Because I think my family, it's hard, but we're going to be okay. We're going to get through this, but our community needs to look after the neediest and the weakest among us, and make policies that protect them as well. So, okay, so those are my thoughts on the Bexar County Health Authority Amended Health Directive of August 7th, and I'll be watching the comments, and please share the link, and encourage folks to read it, and join that Seven River panel if you get a chance. All right, thanks, y'all.